Hi class, my name is Shay Christensen and this is my health educator interview assignment. So I interviewed Ann Whitley. She's a professor here at UAA. She has previously owned her own private practice and has worked at Humana Hospital before it was Alaska Regional. She's been involved in the Anchorage School District for many years and has also worked at McLaughlin Correctional Center. So my interview really focused on the portion of when she was a health educator at Humana Hospital. Anne was the addiction program director there at the hospital. She explained that the practice was mainly for doctors and other staff who worked at Humana who were addicts and didn't really want anyone else to know about it. It was a very confidential unit. But it was mainly for doctors who were addicted to either alcohol or drug abuse. And she was a health educator for about 23 years there. So I, of course, asked her about the theories that she used in her practice. And she said probably the biggest one was the cognitive behavioral theory, which is basically where her and the addict will identify the behavior that the patient needs to change, which is the addiction, and then identify the coping mechanism that they're already using that's obviously not working. So whatever they're doing to make themselves feel okay about it, that's they're trying to identify these things. And then her and the patient would agree on a coping mechanism that may work, and basically try it out. Anne explained that relapses are normal. It's not the end of the world if the patient relapses. But if a patient continues to relapse and if the amount of time between each relapse isn't a significant amount of time, then the need for a new coping mechanism is in need. And she said that you can measure if your coping mechanism is working by how far apart each relapse is and how severe. So if a relapse is a year apart, you can't completely throw away the coping mechanism that you've been using. But when it gets within like a week of each other, you should probably switch it up and try something else. And she said that the unit that she was working in mainly focused on eating disorders, weight management, and of course addiction with drug and alcohol. So Anne really went into depth on how she thinks that health education has changed over the last 15 years. She explained that 10 years ago, if somebody were to talk about sex education, it was super uncomfortable and almost a taboo type of thing. Same with weight management. She explained that people were really offended almost. Don't talk about my 10-year-old son who needs to lose weight. It was just not something that people were open to talk about. But she said that over the last 15 years, people are really starting to realize how health education works and how much of an impact it really does have. And she said that people are just much more open to talk about things. She explained to me that there was a big reduction in the spread of AIDS when people started talking about sex education. And although it was an uncomfortable topic for a lot of people, once the population started to see the decline and how much just talking about it and getting the word out and learning about the disease, how big of an impact, a positive impact it had on these terrible diseases. And that is my presentation. And Anne, thank you to Anne. She was awesome. Very open to talk about her practice and really, really enjoyed explaining to me a lot more about what she did. I think she really believes in spreading the message and talking about things like she went into depth. So thank you.